Welcome, everyone. I'm Josie Conte, and this is Valeri Povey, and we'd like to welcome you all to our recording that's addressing an original lifestyle medicine with its roots in Ayurveda as well as osteopathy. And thank you to the MOA for allowing us to present to you today. So what we'll do is we're going to share with you a slide set, and Kim is going to be bringing that up. And we are talking about a patient who Kim will refer to as a client. Sometimes we'll refer to our person as a rogi, which means a person who has the disease. And we're going to work back and forth between osteopathy and ways of working with the original lifestyle traditional medicine of India called Ayurveda.
Excellent. Thank you, Dr. Josie. Let me bring this and welcome everyone. Let me bring our presentation up for you.
Terrific. And we can go to our next slide. And so I've just introduced myself, but I'm a member of the Maine Osteopathic Association. I'm on the board of directors, and I'm also faculty with the Maine-Dartmouth Family Medicine Residency, Osteopathic Neuromuscular Medicine 3 residency program. I started my studies more formally with the Boston Ayurveda School. This is where I met Kim Povey, who became my teacher, and I have been studying Ayurveda since 2021. I am now certified with the National Ayurveda Medical Association, and I'm very happy to be able to work with my teacher, Valeri Povey.
Thank you so much, Dr. Josie. I too am board certified through the National Ayurveda Medical Association as a practitioner of Ayurveda. I'm a clinical preceptor for Yoga Veda Institute, a faculty and director of Boston Ayurveda School, the founder of Yoga Spirit Studios and Veda Vita Family Health and Wellness. I'm located on the North Shore of Boston. I've been practicing, helping individuals and families with their health, training yoga and Ayurveda professionals for the past 30 years. And I'm currently in a doctoral program for my Ayurveda doctor, specializing in psychology.
Our disclosures are on the next slide. That first of all, we'd like to offer gratitude to the stewards of this unceded land that I sit on in Waterville, Maine right now, the original people of Wabanaki, Mamasit, Mi'kmaq, Passamaquoddy, and Penobscot. And we're also paying respect to the Massachusetts elders, past and present, and the Nipmuc people, acknowledging the truth of violence perpetrated in the name of this country, and to make a commitment to uncovering the truth. We are expressing no disclosures. We have no financial investment or advances from giving this talk, but we also will disclose that we are going to be talking a little bit about a couple formulations, mostly plant-based. Our presentation is intended to demonstrate how physicians can work with members of the other alternative, complementary, and integrative traditional medicine worlds. And some of our objectives today, through presenting a case and following this lecture, we hope that you will have a better understanding of what Ayurveda is and how it's a complete traditional system of preventative medicine, and that you would be able to see 3 common philosophies that are shared between Ayurveda and also with osteopathic medicine, and also to be able to explain the role that digestion of traumatic experiences can play on the body-mind complex. Our biological rhythms are the symphony of the cosmos, music embedded deep within us, to which we dance, even when we can't name the tune. That's a quote from Deepak Chopra, who is an MD and cardiologist. And also to remember that science, like art, religion, commerce, welfare, and even sleep, is based on presuppositions. this quote from anthropologist Gregory Bateson. Thank you. Reminding ourselves.
Excellent.
I think you can go to the next slide.
Okay. Excellent. So I wanted to introduce Ayurveda at this time. It is a comprehensive science. It's a whole system of traditional lifestyle medicine. It looks at 3 pillars of health, which include digestion, sleep, and the management of energy. Every person is unique in Ayurveda, and we address each complexity with very specific skills and disciplines. The study and practice of Ayurveda also involves diverse sciences, and these diverse sciences go back to an oral tradition back in India 5,000 years ago. All of the ancient texts are written in Sanskrit. And so you will see that I will use Sanskrit terminology in these slides to describe words and concepts that are not used in Western language. But these diverse sciences include internal medicine, surgery, ENT and ophthalmology, toxicology, pediatrics and obstetrics, psychology, rejuvenation and geriatrics, fertility, and aphrodisiacs.
And our tenets of osteopathic medicine is to maintain, I'm going to translate these just a little bit, that a person is unique and not a disease, but a collection of the workings of mind and spirit inhabiting a body. That anatomy and physiology are interrelated. That's what structure and function are reciprocally interrelated means to me. And that each unique person has inherent capacity to heal. That rational treatment is based upon an understanding of the basic principles of body unity, self-regulation, and the interrelationship of structure and function. This was approved by the AOA House of Delegates as a policy. And also as osteopaths, this is the 5 model concept from the AAO Journal 2014. So remember, through the neuromusculoskeletal system, we are expressing and affecting everything from biomechanical and structural foundations of a human being, from to their respiratory circulatory model and how fluids and air is circulating and moving, to the metabolic and nutritional aspects of a human being, what we take in from the environment and how we can process and then uptake and use these materials, to the neurologic aspects and that model, from the central nervous system, the autonomic nervous system, and the peripheral nervous system, and the behavioral biopsychosocial model, which I believe integrates a person's society and cultural beliefs and exposures and habits. And then on the side, you'll see that trauma can affect a human being, that infections can come in and affect a human being, that nutrition can come and affect a human being and choices of that nutrition. And that means nutrition that we take in through our eyes, our ears, and our mouth, as well as society and cultural effects. That we treat the whole person and not the disease. Remember that Andrew Taylor Still says the job of the physician is to find health. Anyone can find disease. So this image, that's the rain barrel tree from Stephen Cabral, is, you see something on the surface and we may have diagnoses of how we order different symptoms together, but when we go in deep into the roots and we feed the roots, that we can, address inflammation, stressors, what is toxic thoughts and exposures, improving sleep. This is how we can treat this whole human being. That a reminder, this was a reminder that the ACEs study, the Adverse Childhood Experience study from Vincent Valeri and his colleagues in California more than 20 years ago, it was found that the higher the ACE score, the more exposures that a human being has in their youth, that they're more likely to develop depression, anxiety, poor mental health outcomes, including walking around on this world with post-traumatic stress disorder, that they have and we have ability to develop more chronic diseases and have a higher disease burden, including obesity, digestive disorders, that people with higher ACE scores have a higher propensity for illicit drug use and our desire to self-regulate, and tend to be risk takers or having more sexual risk taking, and that there's interpersonal and self-directed violence and higher propensity with higher ACE scores. There was a study also of 80 children who reported traumatic stressors, and that means high ACE scores, and their resulting nervous system dysregulation had 100% somatic symptoms, 100% emotional dysregulation, 92.5% had disrupted sleep, 82.5% had autonomic dysregulation, 75% executive dysfunction, and up to 71% with digestive problems. So this concludes that it's important to screen people who come in with multiple medical symptoms and look at their adverse childhood experiences.
And our client that we will present on in this study did have childhood experiences that factored into our assessments and protocols. So I'd like to, say that the principles of Ayurveda are very closely connected to the principles of tenets of osteopathy. Every person's unique constitution, known as a prakriti, and all of the elemental life forces, known as dosha, are considered when tailoring a protocol and a wellness plan. So personally, tailoring a combination of nourishment, lifestyle, counseling, herbal remedies is what we will do. And it's based on health promotion and illness prevention side of medicine, primarily. Every person has a physical body and 6 additional subtle bodies known as koshas. And this comprises the mind-body spirit complex. All tissue, structure, and function are interrelated. And the goal is to maintain balance and harmony between the body, mind, and life environment. And that life environment is the not only climate, but it's also the stages of life, the seasons of change, the relationships at home, work, school. All of that is considered as we develop these protocols. Ayurveda supports the concept that each person has the inherent capacity to heal as well. The doshas, or the 3 biophysical manifestations in a human, are explained here as we talk about how the structure and function go together. The 5 elements, Vata, as you will see below, the elements are air and out of space, so what we call akasha. The other elements are fire, water, and earth, and you will see there's combinations that make these structural aspects of the human body. They're organized into 3 main constitutions, and these constitutions, you might also recognize the Vata is similar to an ectomorphic phenotype, a body that's tall and thin. The muscular build of a Pitta is comprised mostly of the elements, primarily fire, water, and the kaphogenic body phenotype is an endomorphic type of body as well. So everything in the Ayurveda toolkit relates to something we call gunas, or qualities. There are 10 pairs. Everything we consume, everything we, even our weather and our environments, all relate to these 20 qualities, or 10 pairs of gunas. Like attracts and increases like. So what we do with these gunas is that we will aim to bring the opposite quality that we have on the other side of this image. So the heavy quality, for example, if a person's constitution is an endomorphic type of constitution, or what we call kaphogenic, heavy qualities are already there. So if you're having heavy food and heavy like lethargy or sedentary type of lifestyle, the qualities of heavy will increase, leading to weight management and obesity. So that's how you can consider these this Ayurvedic toolkit here. And the bodily tissues known as dhatus, there are 7 of these dhatus that are primary tissues in the body. And they are plasma, blood, muscle, fat, bone, and nervous tissue, and also the reproductive tissues. They are nourished in a particular way. Primarily, they're nourished by the food we eat. And every 5 days, this grouping of tissues is nourished. So it's about a month-long nourishment process to, nourish down to the reproductive tissues. And if one of the tissues needs more nourishment, the reproductive tissue might have an imbalance because it's giving nutrition. There's a hierarchy, and sometimes various tissues take more nourishment than others. But this is how we look at the tissue's structure and function, and we start to see the imbalances of how the tissues are forming and functioning. Now, it's important that I brought up also this concept of ojas, or immunity, because the nourished essence of all of the fluids are called ojas. And you can think of it as a bistillate form of biochemical distillate of the tissues. According to Ayurveda, it is a measurable concept in the body, but it gives the immunity, resiliency, and strength and vitality to a person. So when it's plentiful, the person is rested, there's a radiant, glowing complexion, sparkly eyes, they're feeling very centered and balanced. Digestion is very easy. There's a calm, clear mind. They rarely get sick, and they feel light and energized. You can think of it as the psychoneuroimmunology as well, because it is something that can diminish or be increased. So when it's weak or low, it can cause this low mood and fatigue, reflected as a heaviness in the body and mind. Tissues can get depleted. There can be dryness, stiffness, limited range of motion. There can be pain, lack of focus, negative attitude, depression, anxiety, weakness when warding off physiological and psychological stressors. Ama is created, it's a concept that I'll explain in the next slide, but you can think of it as pro-inflammatory waste. And this is created in what we call the spaces in the body, or the channels, on a macro or micro level. Ojas is diminished through chronic stress, any toxicity, unhealthy relationships, environments, non-nourishing foods, alcohol, chemical substances, or any destructive habits or emotions. And it is increased by living a balanced life, resting the body, calming the senses, and cultivating uplifting thoughts and feelings. All practices that promote serenity, consuming nourishing food, and practicing healthy lifestyle habits are the things that I will counsel people on attaining in their lives. So we talked about the tenets of osteopathy and Ayurveda as the body's ability to inherently heal itself. And that's what removing the blockages from these microchannels is all about for us, that if we can remove these blockages, the body's life force will naturally heal. And this is also a good time to, talk about how the concept of digestion is really a large topic according to Ayurveda, because it's not just digesting food, but it is digesting those thoughts, feelings, experiences that one has in their life. It can happen in the mental level or in the physical level. Samprapti is a term we use to describe pathogenesis, or the treatment stages, the opportunities from which to intervene and to bring relief and protocol. There are 2 types of stages. There are those that we balance with diet and lifestyle only. Those are the early stages of Samprapti. or the more complicated stages where we balance with herbal formulations. And I'd like to explain this Samprapti by letting you know that each dosha that I described earlier has its own seat that it stays in. And the stage of the kapha is in the stomach, stage of the seat of the pitta is in the small intestines, and the seat of the vata is in the colon. So as long as the dosha is settled there in the GI system, there is good health and the tissues are forming well and the structure and function of the person is healthy. But as soon as there's these imbalances or the likes that attract likes increasing in the system, there's an accumulation of dosha. And once it accumulates in its own seat, it's similar to this bucket of water that you see, that it gets aggravated and continues to accumulate, and eventually it will overflow and spread from the seat. Here it's gone on to the floor, and you can see how it's found its little divots around some of the bricks there where the water has settled in. So you can think of that as a leaky ceiling that would fall into a bucket and then overflow onto a floor that might have some divots. So even though we're treating with diet and lifestyle to, pick up the residue of the water and to empty out the buckets and to, bring balance and restore the seat of where the dosha resides, that is what those first three stages do, is to work with that ebb and flow. But when the accumulation and the overflow continues, then what happens is that it gets lodged in the tissues. It finds those divots, and then it starts to make cellular change there. So the fifth stage, the preliminary stage of manifestations of the disease, now shows symptoms or these changes in the cellular level. If we, known as, if it was in the floorboard, it would be wood rot. And eventually that would create a problem or further complications in its final stage where we would need to replace those floorboards. And Ayurveda goes to, look at the root causes of all of these samprapti by looking at how we fix the ceiling or where the root cause was in the beginning, which is why looking at someone's health and their trauma timeline is very important in determining where they are in their stage of samprapti. So this brings us to our rogi, our patient, our client, Dr. Josie, if you could introduce her.
I'd love to introduce, I would love to. And so what I wanted to share was that I met our shared person in February 2021, and I started my Ayurvedic training in September of 2021. So I started to first see her as an osteopathic physician, and I was looking for those tissue texture changes once I took a history and reviewed her medications and all of that. And then I started to see with a different set of eyes and sensory awareness of how her body was manifesting the gunas, the qualities. And it was really, I felt that because I know her well, and she really wants to make change, she became a really great study for us, because she was willing to meet with Kim and have someone look at her life and experiences through a different lens, and also willing to make some changes. So just in general, she is a 58-year-old woman and a mother of 4. When she came to me in February, she was having dizziness, photo and phonophobia, and fogginess of thinking, because she just got hit in the head in December by her car door when the wind closed real quickly, and she had a post-concussive syndrome. Her history includes that of chronic pain, fibromyalgia. She was diagnosed with from a physician in Vermont. She had Raynaud's syndrome, chronic interstitial cystitis, dyspareunia, migraine headaches, irritable bowel syndrome, chronic gastroesophageal esophagitis, trigeminal neuritis, anorectal stenosis, osteopenia, asthma, chronic sinusitis. And really the list went on with our different diagnoses she'd been accumulating over her 58 years. Her trauma history began at the age of 2 when she witnessed her father regularly beating her mother. And this, with those mirror genes that impressionable children and all of us as sentient human beings can have a sense of what another person is experiencing, this she started taking on as her own. At the age of 3, she had an accident when her arm went through the front door, breaking the glass and severing an artery in her arm. She went into hypovolemic shock and she required resuscitation and stitches and years of physical therapy to rehabilitate the arm. She had motor vehicle accidents in 1980 where she was hit straight on, head on, and fractured her jaw, her teeth, her pelvis, her ribs, and her clavicle. And then in 1988, another serious motor vehicle accident where she was driving 40 miles an hour, the oncoming car 50 miles an hour. She was a belted driver, pregnant at 8 months, and was hit head on and had the steering wheel strike her chest and abdomen. She lost her baby, and this led to more pain and neuralgia, temporomandibular joint dysfunction, and interstitial cystitis. And then when we had been working together for 8 months afterwards, into February, went to October, November, December, she disclosed to me that when she was around 11 years old, she was sexually molested by teenagers. Her medication list, this is pretty much what she has been using over the last year and a half, include medications to address a lot of different gastrointestinal issues, including the acidophilus, the Linzess for her IBS, Miralax, omeprazole, Zofran for the nausea, but the nausea also kind of related to her neuritis. She was taking albuterol, and she is still using albuterol as needed, the levetiracetam, and she was using triamcinolone cream for the more of the topical irritations. She had carbamazepine and diazepam for the motion sickness and for the neuritis. Nortriptyline, another part of her medication, pharmaceutical medicine chest. And just in general, her social history. So she is married. She has 4 children. She has meaningful work in the palliative care field. And as far as substance uses, she does not smoke or have toxic habits. She, as an osteopathic physician, I just wanted to share with you that as I used my hands and finding her tissue texture changes that felt very dry, and looking at her medication list and listening into her digestive disorders, I saw a very inflamed person, inflamed and dry simultaneously. So I think probably I did a little bit of my own Ayurvedic consultation in my head, and I felt that she had high Vata, like that dryness in the wind. And Kim is going to be countering some of our diagnoses together, so you can see these two things working side by side. Probably the best I could do for her was continue to support her and also suggest that she stop drinking iced beverages. So that was my baby step into making some really simple change in her intake. So we had focused on 4 diagnoses for our study together. There are several more that we will continue to work with her on. But for the first of all, she had this gastritis, nausea, vomiting, and GERD. She had for 48 years, since 1974. Her discomfort with this was a 6 out of a scale of 1 to 10. And now, Kim, if you could give your Ayurveda assessment and translation of GERD and gastritis for this particular person.
Yes, thank you. And maybe I'll just say that when what's a little different here is that as I'm looking at an illness, I'll look at it through an Ayurveda lens. So not necessarily the diagnosis, but I take into consideration what is her primary constitution. She is a Vata Pitta, so both of those are already there. She had high levels of Vata and Pitta, which would influence the disease path. So I look at the nature of the disease, I look at the imbalances, I look at her ama, the level of her Agni or her digestive abilities. I look at the channels, I look at the nature of the disease itself in order to make an assessment. So here, in looking at this first one, gastritis is often when the stomach area is getting increased in its acidic tendency and its acidic nature. So we call that tikshna or sharp. It's also vishama, which means that it did have variability in it. This led to pitta aggravation, hot, inability to digest food, thoughts, experiences. I also suspected disruption to the microbiome from long use of antibiotics, and there were multiple Shrotasamis involved. After working with her at a very short time, the discomfort level improved, and we were able to get her down to a 0 out of 10, a 0 to 2 out of 10.
This is just within 4 weeks or 5 weeks of treatment so far. So this is exciting. And so after we go through the other 3, we're going to then talk about the protocols that were applied. So hang tight. Issue number 2 is her chronic pain, fatigue, also diagnosis of fibromyalgia she had for 43 years, since 1980. This was bothering her as much of a 6 to 8 out of 10.
Yes, and there were times when it was a 10 out of 10, she shared with me. This was one of the higher ones that would fluctuate while we were studying her and prior to working with her. So chronic fatigue from an Ayurvedic lens has a lot to do with ama in the body. I had assessed her as a 2++ level of ama. So this blocked the movement of the Vata subdoshas, and the quality of dry, rough, hot were indicated, as well as sharp and heavy. Her ojas was depleted, and again, multiple Shrotasamis involved. She was able to get to a 0 and a 2 within the time we were working with her, and she is just feeling that her life is changing, and she is really happy with the results.
I wanted to say that the way that ama might affect an osteopathic physician's perception, if you have your hands on someone, you might feel just a density in a person's tissues, or the density. Sometimes a bogginess can be if it's more acute, but it comes out in that way. You can also see it on a person's tongue when you're doing physical examination. So for me, I'm now looking at people's tongues when I meet them. I'm like really paying closer attention. Her issue number 3 that we addressed is interstitial cystitis and a history of Hunter ulcers. These are small ulcers on the inside of the bladder, and it causes intense burning. She's had that for 30 years, and this discomfort can range from 4 out of 10 out of 10 with burning, especially.
This was the one that she was mostly bothered with when I first met her. It was burning, always like this UTI feeling of burning, inability to hold urine, and the stream of urine was also not sufficient. So this she had for 30 years. We were able to bring the burning down after 3 days with our protocol, down to a 2, a 1, and a 0. And these were caused by Vata and Pitta vitiations in the urinary Shrotas, primarily the qualities of hot, sharp, dry, rough. There were also long-term pathogenic types of growths and imbalances in the tissue. And the 3 primary Shrota were the Ambuvaha, which is the pathways that take in water and move water through the system, the Mutravaha, which is how the urinary leaves the body, and the Manovaha, which are the mental thoughts that were associated with this condition. So,
thank you. And then really what she came to me for was the vertigo and motion sickness and nausea, because she was reconcussed in that happened in December of 2020. Then she saw me in February. So here we are working with her. She's had this for 20 years from her original injuries of motor vehicle accidents, and then after that, and she had issues that she would call them a 6 to 7 out of a scale of 1 to 10.
yes, this I would consider and assess as severe Vata imbalances. There were signs of displaced ojas. The gunas here, the qualities of that mobile or that moving, spinning dizziness, is a quality as well as light, dry, rough. This led to the inability for her to process or digest proprioceptive movements. Again, there were long-term cuphogenic crystal growths imbalances, and multiple srostomies were involved. We were able to get her down to a 0-1 using Ayurveda protocols within those 4 weeks. Okay, so let's.
Okay, so now we're going to talk about, yeah, go. I think everybody can read this, and you'll also have the slides as a PDF, so you can go into detail. But I'd just like to tell you, like the overview. First of all, for the GERD, gastritis, nausea, vomiting, which she had for 48 years. Formally, what she did was she was tested for H. pylori. She was prescribed antibiotics. She took omeprazole and was weaned off. Then she had reoccurrence of the GERD symptoms, and she had to start back on 20 milligrams of omeprazole and had ongoing breakthrough issues. She had endoscopy. She was diagnosed with the GERD and also has seen to have a hiatal hernia, grade 3. Went back on the omeprazole, made some dietary modification, and she was using a wedge pillow. And eventually she weaned herself from 40 to 20 of omeprazole, and then she was having this recurrence of her GERD, and she continues to have persistent nausea, especially when she wakes up, and it persists till the middle of the day. So other treatments including the medications, low acid diet, avoiding raw vegetables in the afternoon and evening, avoiding eating 3 hours before bedtime, and using the wedge pillow for sleeping. And then when she began to work with Kim from an Ayurvedic perspective, these recommendations.
Yes, I introduced one specific protocol of drinking 1 cup of coriander tea 3 times a day. And what she had to say was, I love this tea. It's very soothing, mild tasting, settles her stomach. And she thought this was unusual because she developed an aversion to having many teas. She tried them all, and then she said her body would, react and reject it through vomiting. She says, since drinking the tea, I have not had any breakthroughs in GERD issues requiring the use of antacids or Tums, and that her nausea reduced significantly from a 6 to 10 to a 0-2. She even noted that she traveled to DC for a long weekend and that she couldn't make the tea because she was staying at a hotel and she didn't have a stove. And she noticed that unfortunately the nausea returned by the 3rd day. She started back up on the tea and the symptoms went right back down.
The next issue that we'd like to address is her interstitial cystitis with history of Hunter ulcers. She had for 30 years, burning in the bladder all the time, pain intensifying between a 4 to a 10 out of 10 on a 0 to 10 pain rating scale. So formally what she did, she had some treatment in Eastern Maine Medical Center with multiple cystoscopies and hydrodistension, multiple DMSO cocktails, bladder installations at 6-week cycles, bladder ablation, interstitial cystitis, low acid diet, Almiron that she took for 3 years, but she discontinued it because she was aware that there was a clash class action lawsuit claiming that it could cause blindness, and so she didn't want to take that particular medication. And then for her current self-care, she was trying to comply to this low-acid diet, basically an alkaline diet. She was using pre-leaf dietary supplements, which was the calcium glyphosate, and she had acupuncture every 2 weeks. She had OMT once every 6 weeks, and then she was using a Chinese herb, pyrosia, that is a formulation with 14 cooling herbs, and she was taking 2 tablets 3 times a day. And then starting to work with Kim from an Ayurvedic perspective.
Yes, and after 1 week of drinking the tea, this coriander tea that I had her drinking 3 times a day was the primary protocol for these first 2 diagnoses. And she says, after 1 week of drinking the tea and continuing with all other self-care strategies, my bladder discomfort went from a 4 to 10 to 10 to 10 burning sensation down to a 0 or 2, and it has significantly decreased. I am able to hold my urine for longer periods of time, and the flow is consistent without interruption. So I'm going to share with you this protocol a little bit more about coriander. It has these same qualities, these gunas, of bittersweet, pungent, and cooling. So the bittersweet cools the pitta, but the pungency improves the digestion and the assimilation without aggravating the pitta. It also removes ama as well, this pungency to the coriander. But what it does really well is it flushes out heat from the urinary system. This is one of the specialties of this herb. So it is cooling, and at the same time, the heat is neutralizing. So I asked her to prepare 1 cup of water to 1 teaspoon of seed, to boil it for 10 minutes, strain it so that it had a golden color, light yellow, and then take it first thing on an empty stomach in the morning. And I had her take all the protocols at least an hour away from any of her medications. Then I recommended that she add 2 more cups, make a thermos, and then sip it throughout the day, or have 1 cup afternoon and dinner. I have given her other recommendations, more recently that she's just started, and so I wasn't able to report on these findings, but Chandra Prabhav is a cooling herbal formulation, and once we've done the work of removing the ama, what we call amapajana, it burns up the ama, this particular coriander began to cool and work at that level. Now the Chandra Prabhav could go in and actually help to heal the tissue. And there were a few dietary changes. So what's nice is that we're treating both on the herbal side, as well as continue to treat on the diet and lifestyle. And I found that she had a few places of dietary change. I wanted her to avoid 3 things. She was still having acidic foods. She was eating pineapple, strawberries on a daily basis. She would also have onions, peppers, and tomatoes that I asked her to avoid. She was combining dairy and citrus fruits, which according to Ayurveda increases ama. And eating fruits with meals in general increases ama. So I asked her to separate them out as snacks and have them 30 minutes or 1 hour before or after meals.
Oh, feel like we skipped.
There we go. Okay.
There we go. So the next issue that we wanted to address together was chronic pain, fatigue, fibromyalgia, which she had for 43 years. Ever since the car accident in 1988, she had persistent full body achy malaise feeling 24/7, like flu or hangover, every day with exhaustion. And she was diagnosed with fibromyalgia in 1991 by a rheumatologist in Rutland, Vermont. She had tried physical therapy, massage therapy, and then from the years 1995 to 2005, she had no medication of any kind because she was nursing her children or pregnant with a child. And the treatments that she has tried prior to beginning Ayurvedic consultation, she had over-the-counter medication, Tylenol and Advil, an anti-inflammatory drug, meclomin. She used nortriptyline in the nighttime, curcumin, CBD. I think she was using that topically. OMT, which actually started in 2000 and then she restarted recently. some acupuncture. She's tried cupping. She's tried tapping.
And after using the coriander for 2 weeks to start to affect removing the heat and to remove some of that ama, I added Maharasnati herbal formulation, and I'll tell you a little bit about that. But the outcome was profound. Our client patient reports, I am amazed that I'm starting to get my life back. I'm no longer waking up with this full body ache, flu, hangover feeling, which went from a 6 to an 8 out of 10 to a 0 or 2 out of 10. So this was after decades, she says. This flu feeling has lifted. I no longer feel like I'm carrying an elephant around on my back. I'm somewhat still stiff, but with all of the interventions, I am able to do some easy neck and back stretches without getting dizzy or sick, and having an easier transition into walking and moving. She's also feeling less exhausted upon waking, and she has more energy during the day. So this particular herb, the rasna roots, actually are the primary ingredient in this formulation of 8 herbs. But what it does is it balances the vata, especially chronic joints, muscle pain and stiffness, and any inflammation. That's what this rasna does best. So it normalizes the apana and vyana subdoshas of vata, which bring relief to those dry, rough tissue qualities. It also continues to reduce ama through its antitoxin properties, and it does remove those blockages in the microchannels.
And the fourth set of symptoms that we were addressing together is the vertigo, motion sickness with nausea. She's had for 20 years. She was diagnosed with vertigo in 2013. It was sporadic. Her primary care provider facilitated the Eprila maneuver, which was helpful in restoring balance and equilibrium. But then when she hit her head on the car door and she incurred a head injury again, she was reconcussed and went into a post-concussion syndrome. She had more vertigo, dizziness, motion sickness daily whenever she changed positions, which was an issue because she was using swimming to feel better and she couldn't really rotate her head without feeling like she wanted to vomit. And then she was having this motion sickness, was difficult whenever she was riding in a car. So what she had been doing before working with Kim from an Ayurvedic perspective, she tried vestibular therapy, physical therapy, took Zofran. She had to really plan around her travels, like taking Dramamine. She had meclizine. It was ineffective for really long distances. More than 3 hours, she would take a Valium basically and pass out.
Mm-hmm.
Yep.
Yeah. And so the Ayurvedic recommendations was using ear oil. So this oleation process of dropping in some oil on a daily basis and then massaging it in and around the ear, and also using a packing with oil for her head called Shiropichu. And Dr. Josie did these treatments with her, for including some OMT and mama points. One treatment. And after this one treatment, she said, this has been a major game changer for me. After 30 years of struggle, my dizziness and nausea went from a 6 to 7 out of 10 down to a 0 or 1 out of 10. There is no way to describe how debilitating having the feeling that you are off balance and that everything around you is moving all the time. These drops are amazing. I feel like I'm getting my life back. I just traveled to Washington, D.C. and back and handled driving with my husband, driving in multiple Ubers, riding on a ferry with minimal issues, even though she took Dramamine for the plane ride. She went into an indoor mini golf course where there were multiple objects and flashing lights and loud noises. And these are the things that put Vata out of balance. But she tolerated it. And this is a sign that the Vata is subsiding, going back to its neutralized samprapti. And she tolerated it without taking any motion sickness medicine. Bending down to find something in the fridge is no longer making her feel like the kitchen is spinning. Dr. Josie, why don't you talk about this treatment?
I will. I was just thinking how every single treatment you could take like an hour on, but the ear treatment, I I just warmed up some ear oil. I mean, it's like literally called ear oil, but it was oil infused with ashwagandha, calmus, ajimoda, and garlic, strained. There's no particles in it. And I warmed it and I put a couple drops near and around the ear and I massaged each ear before and behind. And I did some osteopathy in the cranial field. I also did some point therapy, kind of not exactly like trigger point therapy. It's called marma points in the world of Ayurveda, which but the very specific points along the fascial lines of the neck, behind the head, and around the head. And then I warmed some oil, and we did a packing. Um, Placed this on top of her head and let it rest for 20 minutes. And while that was on, I massaged her hands and her feet with some warm oil. And I did this once. And we used a very specific oil that Kim had suggested we use. So she sent that to me, which I warmed up as a Balahatari oil. And then I taught her how to make this pack for herself and suggested that she try the oil packing once every 4 or 5 days, at least once a week, and then the oil into her ears, placing it on her fingers, massaging her ears every evening. It was really easy and took me no time to be able to teach her how to do this treatment. And what I learned about looking into Shiro Pichu was to acknowledge that the head and the brain, and then the roots of the nerves coming down are like the roots of a tree, that we see the head and the brain as a tree upside down. So when you treat the oil, and really oil the head, you're feeding all the nerves in the body. And it's a beautiful treatment and very simple. We have our conclusion that the root causes of health problems for her was a Vata imbalance and Ojas depletion that started in childhood from the age of 2 years old and related to trauma. And Kim, I think I jumped in on your side, so I'm going to have you pick up from there.
Okay, sure. We found that our patient had tremendous release by implementing these treatments and these regimens that brought both the tenets of osteopathy and the principles of Ayurveda together. So in other words, she used these integrative natural therapies, which included the manual treatment along with the pharmaceutical treatments. The patient was really ready to change. She embraced this and she made all of the dietary adjustments. She was excited about the coriander and all the herbal formulations. She took to the self-oleation. She was excellent at journaling and helping us collect our data. We really didn't have a chance to report on all the Ayurvedic counseling I was doing with her. We call this Satvavajaya. And we also, contribute her progress to some of the counseling work that was also happening when we were working with her. The body work also are the ways in which we worked with her. Well,
yeah, and so as a final statement, we want to recognize the similarities of treating the whole person and also recognize the gaps in an understanding of the different fields of practitioners and traditional medicines. And so it's really wonderful to meet and talk to other types of practitioners, so that as physicians, from my perspective, it's really it's so helpful to have folks in the community or through the internet that I trust, and we can talk about formulations and look at the medications and how do these work together and are they safe. That there's so many applications to explore in the future for continued studies together. We didn't get to report on all of our findings, including the Ayurvedic counseling and genetic epigenetic factors that we found in the patient's maternal heredity. And there are other symptomatic treatments that we intend to address specifically for this patient that we presented. They're not included in this study right now for presenting, but you know, a human being is evolving and changing and responding to their environment and different incidents that happen throughout weeks and months and years. So this is an ongoing practice to be able to empower your person, your patient, your client with ways of self-care, making little modifications when they're ready and willing to make those changes and to be present and support them until they're ready. So also in conclusion, we'd very much like to thank you all for attending. And I hope that you would feel comfortable in contacting Kim or myself if you have any questions, if you have any interests in how to pursue more studies. You don't have to know everything. You can just learn a little bit about these different fields of practices and become familiar so they don't seem so foreign. Know that they really, it's very possible to work hand in hand with other providers. And it's important to help people find other supports in their own community, within their families, and in this world, because there are lots of different paths. And we don't need to be everything for everyone, but we can do our fair share. I'm really happy to be an osteopathic physician. I'm so grateful to Kim for being my teacher and to the world of Ayurveda and all that it has to offer. And I'm just definitely scratching the surface, and I hope to learn more. Thank you to all of you, to the Maine Osteopathic Association, for giving us this opportunity to bring our two worlds even closer together.
Yes, thank you so much, Dr. Josie. It was a wonderful opportunity to collaborate in this way, and I look forward to working with this particular patient and to continuing our work together.
Yeah, thank you. And here we've listed a few references and resources. Hey, that first resource there, Patrick Conte, is not a relative of mine, but he wrote a book called Converging Paths of Ancient Ayurveda and Modern Medicine. It's really good. I think he does a very fine job of walking in the two paradigms and bringing them together using some of the language. It's very medical doctor friendly. And then here's the Felicity study that you are probably have been made familiar with. Dr. Vasant Lad is among the doctors who have written wonderful books, accessing and making available knowledge of Ayurveda to the Western eye and ear. Kate O'Donnell, who actually lives in Portland, Maine, she's written now 4 books. This is a really great book on Ayurveda cooking. Other resources. So thank you so much, and have a wonderful day, the rest of your Sunday afternoon, or whenever you're watching this this presentation. Don't forget to record and give us feedback so you can get your CME credits. And to everyone else who may be watching this at some point, there is our timer. We're right at 16 minutes.
Thank you so much, Dr. Josie.
Thank you.
Wonderful. Okay.
Bye.
And you'll stop recording.
I hope that I did stop the recording. Here I
No,
go. Now.